Regarding health information exchange activities, what do you see as next steps for this in 2011?
2011 is going to be a very busy year for health information exchange. There will be considerable ramping up of activities for the health information networks that ONC is sponsoring, including both the directed exchange and the networked exchange models. We have a lot of people who are on board and interested in doing this. We also have the state health information exchanges that will be launched in 2011. They've been doing ramp-up activities throughout 2010, and we expect to see a lot of activity of health information actually being exchanged in 2011 after we have spent the last year doing the preparation work and writing the specifications and standards to allow that to happen.
How are the stakeholders dealing with the balance between the needs for privacy and security in healthcare identity and the innovation and progress goals being set for the exchange of healthcare information?
Obviously, privacy and security for patients is paramount, and both the Secretary Sebelius and Dr. Blumenthal have made statements to this effect. We are committed to the privacy and security of individuals' health information. Nonetheless, we are also committed to innovation and growth. We must be, because we have such a long way to go to catch up with the rest of the world and bring health IT fully to bear on some of the issues facing healthcare today in the U.S. So we are cognizant of privacy and security throughout the entire process. We have Tiger teams that are working at each of the in each of the domains that we are undertaking, including standards and certification, as well as the build-out of the health information networks. We're also working closely with federal-wide initiatives like the National Strategy for Trusted Identities in Cyberspace to help leverage some of that work to improve identity management across the board, because we see that as one of the biggest challenges.
What are some of the challenges that health information technology is facing in identity management?
So identity management in healthcare represents quite a few challenges. We have many entities that have to be identified and credentialed, not just providers, and thinking of the small provider, you know, the doctor in his office, but all kinds of providers, including physician's assistants, including nurses, and other care providers. We also have to think about how entities become credentialed and identified, so that when we're exchanging health information from hospital to hospital or lab to hospital, that we know and can trust in the identity of the entity that's exchanging information. And these are some of the questions that our privacy and security Tiger team has been tackling, and they have really done yeoman's work in this area. And again, we are trying to make sure that we stay aligned with the principles in the National Strategy for Trusted Identities in Cyberspace, and we're really kind of stretching the boundaries of what they're looking at when we start talking about doing identity management for entities and not just individuals. So it's interesting times.